Hi, my name is Lee Fogel. I am the volunteer leader of Pulmonary Success Circles, and also I'm a patient who was diagnosed with severe and advanced pulmonary fibrosis about 5 years ago. Today I live a very full and active life, walking, exercising daily, and being active socially. And I still have lung scarring. Obviously, I still wear oxygen 24 hours a day, but oxygen supplementation is not a handicap. It's my superpower, I call it. I live a full active life, able to hike, exercise daily, walk daily, golf, generally enjoy a full and active life. A key turning point for me in my own personal journey from being severely deconditioned 5 years ago after learning I had pulmonary fibrosis, a key turning point for me to learn to live a full and active life with lung disease was when I joined Pulmonary Success Circles. I was later asked to lead the organization as a volunteer, which I do today. That doesn't come with a salary or anything like that, other than the joy of helping other patients learn to live better with lung disease. We are an all volunteer-led, patient-led, completely free organization. We have no corporate sponsors or revenue of any sort. And we're organized into small 8 to 10 person patient support groups led by volunteers who are patients like me. And we meet in these circles weekly on Zoom calls. We all are face to face. We can see each other's faces, and we sit around for an hour each week and we talk about what's going on in our life. What are our challenges and what are our celebrations? We have patients from around the world who are at various levels of lung disease, various ages, and we get to know each other as a small group of people, like a family. We share our journey together while learning to live well in spite of lung disease. We share our experience, strength, and hope as we journey together. Patients in our groups will consistently tell you that living with a lung disease is much easier, and they're able to live a better, more active life by being a part of a regular group. Why is that? Well, we learn so much from each other and what is working for us in our own experience, whether it's using oxygen, mitigating the side effects of certain medications we may be on, exercising, or eating a healthy lung health and heart health diet. It's a wealth of information from this community that we share together. Some of you may already be members of a patient support group that meets monthly. Most of those groups are organized by a hospital or a pulmonary clinic as an educational group where patients meet face-to-face once a month for good, informative disease education. What they lack in those groups is a time for patients to really get to know each other and openly share their own difficulties and successes on their lung journey so that others can learn from them as well as encourage and support them. The vast amount of information shared by people in our Pulmonary Success Circles groups becomes a sort of a tribal knowledge, if you will, of ways to live well in spite of lung disease. Our own personal tips and tricks for living with oxygen or exercising, things like that. I've had so many patients tell me that they have learned more in just a few meetings or weeks of meetings with our support groups than they have in all of their pulmonology appointments over the last several years. Think of it like this. Most patients see their pulmonologist once or twice a year. In that time, they typically spend 10 minutes with the nurse or assistant and 10 minutes with the physician or the pulmonologist. That's about 1 hour a year to be heard and be heard by a medical professional. And most patients report to me that they're frustrated with those visits. They don't get enough time with their doctor. They don't get their questions answered. On the other hand, in our Pulmonary Success Circles, we have 1 hour per week to share our own experience with our own journey. And so we get 52 hours a year of high quality time with experienced fellow patients learning and growing together. We're all active and focused on living a full and active life in spite of lung disease. We're intellectually curious people, and we do our own research, and we try different methods. We try methods for staying active, for eating right, and we share that information with our small groups. And our volunteer leaders across this organization will cross-pollinate the good information across all of our groups. So we're building sort of a tribal knowledge, if you will, of patient information, which is a very valuable thing for all of us. Most of our support group members will tell you that it is their favorite hour of the week. And just to get on that Zoom call, see all their friends and fellow travelers and talk about what's going on in each of their lives with their health. We typically talk about it in two ways. What are we navigating and what are we celebrating? What are our challenges and what are our victories? That sort of thing. It is important to note that we do not diagnose or treat medical conditions, and we don't recommend medications, either over the counter or prescription medications, but we share our own experience and what has improved our quality of life. If you're interested in joining a patient support group, please send us an email at the address that you'll find in the description of this video. If you'll click the More button on the description, it'll lead you to our site and to my email address. And send us an email that you'd like to know more about this and we'll respond to you. Or you can click the More Information button on our Pulmonary Success Circles website. Thanks very much. We hope to see you in a group one day.